my name is Stephanie and I'm going to be your nurse today. Can you please state your full name and date of birth?
Grace Scott, 9801.
Okay, this is the correct patient. Do you have any known allergies?
No, ma'am.
And what pronouns would you like to go by today?
She, her.
Okay, today we're going to be doing a focus assessment. It should take about 5 to 8 minutes. If you have any questions or concerns, just let me know anytime during the assessment, okay?
Sounds good.
Patient understands the exam. I'm going to give you this gown to put on. You can tie it in the back. Do you feel comfortable in terms of privacy and temperature of this room?
Yes, ma'am.
Patient is comfortable and prepared for the exam. I'm just going to start off by asking a few questions, okay?
Okay.
Have you had any problems with your lungs, respiratory, upper respiratory, or have any chronic respiratory illnesses?
No, ma'am.
Have you had a cough recently?
No, ma'am.
And have you had any shortness of breath or trouble breathing?
No, ma'am.
And have you ever been or are you currently a smoker?
No, ma'am.
Okay, if patient were to show signs or symptoms, I would use Olcott-Zeiss assessment and techniques for special circumstances. Patient appears relaxed and at ease. Breathing is unlabored. There's no use of accessory muscles for breathing. Patient is sitting up straight and there are no lesions that are to be noted. I'm just gonna have you hold out your finger. I'm gonna take your O2 levels. And I'm gonna have you hold out your other hand for me, like this. And I'm gonna take your pulse. Okay, respiratory rate is 16, O2 saturation is 98%. Skin is pink, and oral mucosa is pink, nail bed is pink, and nail bed is at 160 degrees. Okay. So now I'm just going to be checking your chest to just assess your breathing, so just breathe normally for me. Thorax is symmetrical. Coronal angle is 90 degrees. Muscle development is equal bilaterally. And now I'm just going to assess your breathing, so just breathe normally for me with a little bit deeper breaths than normal, okay? Take a deep breath in for me. Testicular sounds predominate over lungs, and there are no wheezing or crackles or any other abnormal sounds. Okay, so now I'm just going to gently touch your chest and your throat area by your collarbone and on your ribs, okay?
Okay.
Let me know if you have any pain. Okay, trachea is at midline and slightly movable. Clavicles are stable, strong, and proper muscle development is surrounding them. And ribs are stable, symmetrical, firm, and painless. Okay, so now I'm going to have you say 1, 2, 3 every single time I move my hands, okay?
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Vibrations palpated are equal and bilateral. I'm going to have you turn to the side for me. Sorry. Okay, so I'm just gonna look at your back and assess your breathing. Coronal angle is 45 degrees. Scapulas are symmetrical, thorax is symmetrical, and muscle development is equal bilaterally. So now I'm just gonna listen to your lung sounds. Just take deep breaths. And for me, I'm gonna have you cross your hands. There you go. So just take some deep breaths. Okay, first say spine is straight. Sounds heard in the posterior upper quadrant, and there are no wheezing, crackles, or any abnormal auscultations. And now I'm just going to have you do the exact same thing, but I'm going to do it on your side, okay?
Okay. Okay. Very good.
Sounds heard on the lateral region of the lungs, and there are no abnormal sounds such as wheezing or crackles. I'm just going to have you count 1, 2, 3, losing time with my hands again, okay?
Okay. 1, 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, vibrations palpated are equal and bilateral. This concludes our exam, and your doctor will be in a couple moments.
Okay, thank you.